Good afternoon. Thank you for joining us this afternoon for the Polar One Overview webinar. My name is Alex Dolezal, Team Leader Digital Health and Quality Improvement at Central and Eastern Sydney PHN. You might have seen recent correspondence from Central and Eastern Sydney PHN regarding our transition to Polar and the decommissioning of PAN-CS clinical audit tool. If your practice has not yet obtained a Polar license, please contact us at digitalhealth@cespen.com.au to receive one free of charge. Before we begin, I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize the continuing connection to land, water and community, and I pay respect to elders past, present and emerging. I also extend that respect to Aboriginal and Torres Strait Islander peoples joining us this afternoon. Please note, this event is being recorded. Please post your questions to the Q&A function. The evaluation survey will be emailed to you after the webinar. We will also paste the link to the evaluation survey in the chat during the webinar. We appreciate your feedback. Please complete this to allow us to issue certificates of attendance. Upcoming CPD events are listed on our website. The presenter for today's webinar is Diego Benitez, Service Desk Manager, Outcome Health. With a career spanning over 2 decades in IT, Diego joined the Polar support team in 2019. Now he is channeling his expertise into the new focus on training and education. Please welcome Diego.
Thanks, Alex. Thank you for your kind words. Now I'm going to share my presentation. We've already done the knowledge of country. Let's get started. Okay. So welcome everyone. What we're going to be doing today is we're going to be doing an introduction to Polar Explorer. I know most of you have probably never seen Polar, or if you have, you'll be very new to it. So this is a very quick intro to our main report, which is the clinic summary report. And we're also going to introduce Walrus, which is a point of care tool, which is the equivalent of Top Bar, I believe, you'll be using by PCS. So we're going to be doing those two. And if we've got time, we're going to do patient flagging, which is a small it's another function that allows you to flag patients that are not easily identified by your clinical information system. Okay. So Ben is, Alex already introduced me, but I introduced my colleague Ben. He will be answering the questions. So if you've got any questions during the webinar, feel free to pop them in the Q&A, and Ben will do his best to answer them. And if he cannot answer them, he will give me a little nudge and we'll be able to answer it live. Ben graduated from Deakin University quite a while ago, so he gives me a bit of crap about that because it's probably update his bio. He started off being a developer for Outcome Health, but now he's shifted his focus to the support, and he assists me in the webinars, and hopefully soon he'll be running his own webinars. What are we going to do today? We're going to hopefully let me see. Yep. As I mentioned earlier, we're going to look at the clinic summary report, including the clinical indicators, and it'll make more sense once I start showing you the product, patient flagging, and Walrus point of care tool. Sorry, I've got the wrong slides. My apologies. So I was a bit thrown there because I do have the wrong slides. So hopefully, if you haven't got Polar installed on your practice, I believe the CESPEN team has shared a link to book the appointment with us. And basically what we do is we jump into your server and install the client, a little tool called Hummingbird, which will extract your data, and then we'll be able to create your reports. Let me share my screen again. Apologies about that. I thought this slide looked a little bit weird. Cool. So, learning outcomes. This is a better one. Hopefully by the end of today, you learn how to utilize the clinic summary report and how to log into a portal. We'll go over some basic functionality about the clinic summary report, how to use the clinic summary report to undertake quality improvement activities, walrus understanding, how to access our learning resources and knowledge base, and how to request support. So what is the clinical summary report? It's a holistic report. It basically has no single purpose. As I mentioned earlier, we extract your data, we add the analytics, we add the insights, and we'll make it available to you via a web portal. We don't install software per se. All that reporting will be available through a web address, which is polarexplorer.org.au. Don't worry, you don't have to remember everything. We'll be sharing all this information after the webinar. The purpose of this report, it really depends on your focus in your practice or what may be going on around at the time. I know around, maybe not so much now, but early in the year, we've got a lot of interest on flu reporting and flu vaccinations and what you did last year and you know, what you may forecast for this year. It all depends, you know, what's going on around the world as well, or what incentives there are. We've got many different uses. It's not a purpose report. It's really up to you how users report. It can be a little bit overwhelming at the beginning, but trust us, once you get your hands on the report and start using the report, you can't break it. It's a one-way communication, so it doesn't write back to the clinic information system. You cannot break anything. So, you know, once you get your hands on the report, my number one suggestion is to jump in, have a look, navigate, go through all the menus, go through all the different pages, and get familiar with the report. The data is refreshed every 24 hours. So we do the extraction every 20 minutes. We extract the changes after the initial extraction, and then we'll refresh your reports every 24 hours. It's important to know as well that no identifiable information leaves your practice. This gets removed by a Hummingbird tool, which is a data extraction tool. The information then gets sent to us. We add all the smarts, all the analytics, all the insights. Then we send it back to your practice, and it gets re-identified at your practice, and then you can access the reports that way. I'll put a little link here. I will share the slides with you after. That is a little bit of information on the on a knowledge base. However, until you have Polar Explorer installed at your practice, you will not be able to access it. So I should mention that, but at least you have the slides. So when you do have that installed, you can go on and jump on that and have a look at a knowledge base. Just remember, if you've got any questions, feel free to ask at any time. I'm happy to answer them. Okay. So the clinic summary report is what we refer to as the Polar cake. And it's basically, we start with the demographics at the bottom of the cake. It's got all your information from your practice, and then you start adding filters. So by adding the filters, so the slice of the cake or the layer of the cake gets smaller. So you may add something like, you know, you got your demographics, you know, female, male, your age group and whatnot. Then you might want to add diagnosis, and that's layer gets smaller, and then you add medications, and then pathology, radiology, MBS, etc., etc. So you may start, and the sample that we're going to look at, we start with 80,000 patients, but by the end of you know, all the filtering that you've added on in the process, you may end up with only a couple of hundred of patients. It's a much smaller cohort to work with. And basically that's how the clinic summary report works. So some common items that we add here, whether this practice status is active or inactive, RSCGP active, some risk factors you may add, most inclination, chronic diseases, data quality items, and whatnot. And that's how we operate the Polar cake. And it all make more sense once we start showing you the report. Cool. So we're going to do a couple of learning activities to showcase what the clinic summary report is all about. And the first one is we're going to do a bit of a data quality exercise, which we're going to identify patients that have no smoking status recorded. This activity will assist in auditing your active patients, both RSCGP active and practice active, and identifying patients who have missing demographic clinical data in line with the guidelines from the RSCGP. Then we're going to do another learning activity, which is immunization. So more topical towards the beginning of the year, but we're going to identify patients that have not had the flu vaccine this year. That's for later. And now we're going to jump into the report, which is probably what everyone's waiting for. Okay, so I'm going to quickly jump out of here. So when you have your credentials, you will navigate to polarexplorer.org.au. You will enter your username there, which will be provided to you once we create your practice, and a password that will be set by you. Once the user is created, you get a link, you go and set your password. Once you set your password, you sign in. Now, when you first sign in, you're going to have to fill out an MFA. We're prompted with an MFA page where you have to verify your email address, and you also need to verify your mobile number. Mobile number, it's only used for MFA purposes. We will never call you on that mobile number unless you tell us to, and we won't send you any spam either. This is the landing page. This may vary from time to time, that depending on what Alex and his team may want to communicate to you. At this point, we are promoting Husky, which is a new product. In a couple of months' times. Actually, on tomorrow, we've got a release of Puffin, which is a report that will assist practices with GPACE program. So tomorrow, this may change. On the left-hand side, we've got some quick links. We've got some demo reporting. We've got some resources to Husky, which is the optimization tool, which we'll do a webinar on as well, but more on that a bit later. And then we've got some quick links for education and support. So here you can access our knowledge base and release notes, and also support, which is important. If you have any issues, how to contact support, you just click on this link. We're clicking here. Not this link, this link. And you just fill out all the information, what you're having an issue with, send an email, and that will raise a ticket with us. Okay. And again, we've got some report quick links, but I will run another session to showcase more of this page. What we're going to be looking at today is the clinic summary report. So if we go to the web reports, yours may look a little bit different. I just got a lot of demo reports here. So we're going to look at the clinic summary demo. You get the little polar bear, that's the lighting. So this is the landing page for the clinic summary report. So at a glimpse, you can see all your patients on the top left-hand side here. In the green person, it shows you all the active patients for your practice, and the grayed out crossed out will show you the inactive patients for your practice. We've got some quick filters here, so we can add to select only RSCGP active patients, which is 3. It's patients that have 3 or more separate visits in the last 2 years for your practice, and practice active patients, which has been these are patients that have been flagged at your practice as being active. Okay, so if we quickly do that, all right, we can see that that number has dropped to 11,000. So we only have the active patients, essentially. At a glimpse, we see the osteo categories, patients that are high risk, intermediate risk, and low risk. We also see the urgent, high, medium, and low risk for the hospital avoidance tool. We actually have a report purely on this, which is basically showing you patients that are likely to be admitted to hospital within 12 months. We're doing a whole webinar as well on this HAT report next week, so make sure you sign up for that. Then we've got cardiovascular disease and liver cirrhosis, high-risk patients. Okay. At the bottom, we've got new patients by month. It's basically to see a trend on your practice, and returning patients by month. This is, by the way, all demo data, so don't worry about seeing any names or identifiable information. It's all pretend. On this bar here, it will have a little green tick if you participate in the PIP-QI activities. Then it will give you a green tick if you're compliant for this quarter. If you're a multi-location site, it will tell you which locations you're compliant for and the latest compliant date. So basically, the last time we were able to extract data from your site. So on the left-hand side here, you see a bunch of filters, and we're going to click on the three dots to expand that. And this is what we're talking about with the layers. At the moment, we've got the bottom layer of the cake, which we've got a second layer of the cake, because we added a filter. So the more filters you add, the smaller the number of patients that you're going to work with. Okay, so we're going to quickly look at some of these. So here we've got some patient categories. We already clicked these two. There's many ways that we can do the same thing, but I will let you discover that when you get access to your reports. If you're a multi-location site, you can select location, activities, your DVA status, most inclinations, and things like that. We also have the patient demographics, which we can go into age, and you can either click one at a time or typing them in. You can type them in there as well. Once you have your selection, you can either select the tick to confirm your selection or just click away. So if we go 0 and 1, click away, and that would only select those patients that are 0 or 1. We can go ahead and remove it from here, or we can also just remove it from here. Like I said, I'm not going to confuse you with all the many ways that we can do the same thing, but there is many ways that you can do the same thing. And as you get familiar with reporting, it makes sense why sometimes you will do it here, why sometimes you will do it here, or from a different part of the reporting. Okay, so we've got risk categories, we've got activities, providers, diagnosis. If you want patients for a specific diagnosis, you can do it here, specific medications, and whatnot. Okay. So we also have, on top of these filters, we have different menus here. So this is the dashboard, which is a landing page, and then we can go into patients, which the same allows you to drill into your patient demographics. From here, you can select age groups, either suburbs, if we're not focused on a particular suburb around your practice, ethnicity, gender, indigenous status, pension, and DVA status. And the cool thing about ethnicity is you can double click, and then we'll drill down into Oceanian peoples. And you should be able to select up here, and then it goes into more specific Oceanian peoples. We can remove that. Just about everything that you see is selectable. So if I want to select age group 0 to 4-year-olds females, I just go and click on that part there. That will select everything, and then I can just go. I should be able to. Yeah. No, sorry, that selects only the age groups. So it drill down into the 0 to 4s, and now I've got the 0s. Now you can see 1, 2, 3, 4. I can select different age groups from within. So everything's pretty much selectable. If I want to select TVA status not specified, I can click on that, and that will give me people who know TVA status data from 0 to 4. Obviously, you would have knew that, but I just wanted to showcase how their report works. Cool. I'm going to remove that. So going back to the menus, there's quite a lot we can do there. So we've got patients, we've got quality, we've got risk factors, we've got my health records. In clinical, we've got things like clinical indicators, diagnosis, prescriptions. I'm more specific about clinical information. Then we've got MBS. We will quickly touch base on that as well, if you'd like that one. And then we've got some practice specific information like statistics, geography, where your patients are located in the map, activities for your clinicians, and a bit of heat map as to what days your BCS, what times your BCS, last activity for your patients and whatnot. So we're going to go back to the dashboard, and the first activity was data. It was a data quality exercise, and we wanted to highlight patients that have not had the smoking status recorded. Okay, so we're going to go back here. We're going to leave this the quick filter for RSCGP and practice active patients selected. We're going to go to patients, and we're going to go to quality. Okay, from here you can see all these quality for your practice, and you can see obviously green is good, yellow is it's good, but it's not quite there. You know, the RSCGP standard is 75%, and C for emergency contact, we are on 72.73. So you're almost there. So, but you've got a little bit to go. And then we've got red, which is obviously not good. So we want smoking. So what I'm going to do is I'm going to quickly click on the smoking one. And now that has given me, from the 11,000, it's giving me 2,517 active patients that do not have smoking recorded. Okay. And then you can see from here, patient list, if we click on that, we can see that we can export that, we can further analyze that a little bit more for further analysis to see, let's get this recorded. But we can also see that we've got patients here that have they're 3 years old, the 1 year old, the 5 year olds. Obviously, you don't want them because they're a little bit young to be smoking. So what we've got here as well is the RSCGP accreditation standards. So we can quickly click on that. And we need to click on that again. And now we can see that that number is dropped to 1,670. So what it's done, it's removed everyone. I believe it's 10 and under, I think the accreditation is. We can quickly check that by going to patients. You can see that it's only left everyone 10 and over because that's in line with the accreditation, RSCGP accreditation standards. So if we go back to quality, we've got 1,670 patients that do not have smoking recorded. Okay, and now we can again go to the patient list. Now we can see that everyone is over the age of 10, and we can export this list for further analysis or whatnot. In circumstances, you may export this list and maybe call them back for instance for a flu shot. If they haven't had the flu shot, this patient list can be exported as well, and you can run a program calling everyone back, hey, you're due for a flu shot, whatnot. Cool. Let me know if you've got any questions. I know this can be a little bit overwhelming if you've never seen this before, but like I said, once you get your hands onto this report, it is actually quite easy to use. Okay, so we're going to remove the filters, and we can, the same way we add filters here, we can remove the filters from here. So there we remove the smoking standard. We can do the same with alcohol. And for alcohol, it's 15 and over. So now I select everyone that doesn't have alcohol recorded. So if you go to patients, yeah, it's got 15 and not over. So it's already does it does that selection for you, which is it's pretty cool. Cool. We're going to remove that standard, and we're going to remove that. So we're back to only the active patients. Okay. So that is the first activity. And the second activity was the flu vaccine one. So we're going to identify patients that are active, not particularly. We're going to remove the RSGP active patients because you might have patients that only go once a year to get the flu vaccine. So we're going to leave them here. And then we're going to exclude patients that have had the flu vaccine in the last 12 months. And then we're going to review that patient eligibility group. Okay, so going back here, we're going to go back to the landing page. It's a good spot to start. We're going to remove this quick filter. And we're back to the original 84,000 patients, but we want active patients. Okay, so we're going to select active. And we can either click on the tick or we can tick away. And now we're left with 40,000 patients. Okay, so what we're going to do now, we're going to go to clinical and then clinical indicators. Now, clinical indicators, it's a very, very powerful section of the clinic summary report because it allows you to include patients, but it also allows you to exclude patients. So if we go back to the list, we want practice active patients here. And we want to exclude patients that have the flu vaccine already. Okay, so we included active patients. Now we're going to go to the exclusions, and we're going to go to immunizations, and we're going to select flu. So we can see in inclusions, by including active patients, we included 40,000 patients. Okay, but now we excluded 11,000 patients. Okay, and we're left with 33,000 and a little bit more patients. But we don't want to exclude everyone that's had a vaccine because some of them might have had it. We record up to 7 years for that information. Might have had it 6 years ago. So we want to exclude everyone that's had it last year. So now we've included only 2,000 patients. So it's an assumption that they already had it this year by doing that, so they can do it again. So now we've got 40,000 patients. And this is where it gets tricky. You're not going to try and get 40,000 patients back. So you might want to go back and then go to the age and say, let's focus on anyone that's 40 over, 70 over, or you select your range, and you might want to do 40 and over. You can highlight it that way. Cool. Now we've got 18,000 patients that are potentially required the vaccine. So you might want to get them back. Or then you might want to get tricky and say, have these patients have a vaccine ever? Are they likely to have it again? And then you start playing around with the data a little bit to see which are likely to get the vaccine this year. Okay. Again, we'll go to the patient list. We export it from here. So if you go to export data, that will export it. This is quite a large number, so it's going to take a little bit. That will export to Excel. And then you can play around with this. This can go into one of your SMS systems, so you can try and get patients back. You get the idea. Cool. You can pretty much export patient list from anywhere in our reports, and in all our reports, you are able to export the patient list. Being a bit mindful of time. Cool. Okay, so that's it for the flu vaccine. These are patients that have not had the flu vaccine in the last 12 months. Okay, so we can quickly remove all these filters by selecting this little box here. And we also have undo and redo if if you wanted to just remove the last filter that we applied. Cool. So what I'm going to show you now is something that is very popular. Again, we're going to go to the RSCGP and practice active patients. Okay. And we're going to go into the MBS section, and we're going to go into tracked MBS. Okay. So the tracked MBS, you're able to select an MBS item and be able to see the eligibility, whether they're eligible for, in this case, the GPCCMP, which is the latest one that we've added. At the moment, we've got 563 that are active. And then we've got 9 for review. Okay. And of those, we also have 4,346 that have never had it. We've got actionable items for this number. We don't have that because it hasn't been 3 months since it started. So by October, so in a couple of weeks, we're going to be seeing these numbers populate. But you can see what we had that for GP, MP, and TCA, but obviously it's no longer eligible. So these are quite empty. Eventually, these 2 will disappear. And this one will start populating numbers as of October 1st, which has been 3 months since we potentially had the first GPCCMP MBS item. But we also do have that for mental health and indigenous health assessments and a few other MBS items. We don't have all of them, but if you have interest in a particular one, we can always start adding. Which is that the list will be too big if you start adding all of them. You can also see the eligibility for 3 months, 6 months, 9 months. So you can forecast when your patients are going to be eligible for an MBS item. So in this case, we've got GPCCMP. Probably not a good one because it's not going to, may not have much. Let's go 49. What is it? 49 health assessments. So we can see your patient cohort here. These are your patients, the name, the item, when they've had the latest 45 to 49 health assessment, where it's about to expire, and potential anomalies, whether they've got chronic diseases, and who the most in doctor is. So you can't just filter by one doctor. Or a couple of doctors as well. Cool. I'm going to remove that. And you can see this is the 3 months. You can see future eligibility. Okay. For future eligibility, you can see within the next week, as of tomorrow, you're going to have 40 patients. You can see 7 to 14 days, and this will allow you to forecast as to when they're going to be eligible. So you might want to get them back. So, you know, for these 40 patients, as I mentioned earlier, so now we've selected 40 that will be eligible for the GPCCMP item within the next week. So you might want to get the patient list and send them an SMS saying you're eligible for a care plan. Please make an appointment with the practice. I know I've got those in the past, and I like to think that they use Paula to get that information. Cool. So this is the MBS. Some of the cool things for the MBS section is also you have potential revenue. Let's remove that. And this is looking at your data. Now, before anyone asks, we do not look at product from here, and that is future eligibility. So some of these items may have been claimed elsewhere, but we do have another report that will help you with that called Husky that we will be having a session on later in the month. Cool. So this will give you some numbers, how many patients are eligible for this, and the potential rebate and revenue and whatnot. Cool. So we've got here your MBS revenue as well, some figures for previous years, you know, highest numbers, and also MBS services, which is instead of the revenue, it's got the item numbers. Cool. So this is the MBS section. Like I said, if you've got any questions, please ask in the Q&A. If there's something that you want to see, please let me know as well. Okay. Other things that are cool, this is suggested activities of what we can do. Mark patients not seen in the past 3 years, inactive in this in your clinical information system, RSGP accreditation quality items that we looked at when we looked at the smoking, patients that are missing smoking, and care plans that we also looked at as well. This is some good things to get started on when you get access to your Euler. I will show you the first one. And we have storylines. So storylines is what we use for our walkthroughs. We don't use PDFs or Word documents. We actually use an interactive video, which I will show you quickly to show you how to do things. So if we go back here, let's go Education Hub. The same login that you use for Polar will work for every one of our platforms. We've got a section here called Storylines by Polar. And we're constantly adding things here. So let's go, say, clinic summary report. Let's see. So basically, this is how the storylines work. Here we identify an RSGP and practice active patients that are 15 and over without smoking status recorded. It's essentially what we just did. So we got start, and this will give you a little bit of a pointer as to where to click. And this is how, it's a bit of a similar one. This is basically how we show you how to do things. If we create this on the spot, they're very easy to create. I won't go through the whole thing. So if you want something created, we go ahead, create it, and then share it with you. And then we post it on here because likely someone else will benefit from this as well. So we are constantly adding these. I reckon we're adding about 2 or 3 per week on this platform. So that we think that was the best way to share walkthroughs. Cool, where was I? Okay. So a bit of a cleansing exercise is marking patients inactive that haven't been to your practice. So if we go to practice here, we've got activities. You have all your patients by last activity. So you can see you had 4,500 in the last month, but you can see that there's 9,000 that have not been to your practice for 5 years or over 5 years. So you might want to review those patients and see whether you mark them inactive in your clinical information system. Be mindful that some of them may rock up maybe once every 5 years for a specific checkup. But by cleaning up your active patients, by default, you will improve your quality as well. So that's a good exercise to start off with. And then you can move on to the between 3 and 5 years and whatnot. Cool. No questions. Now we're gonna look at the Walrus, being mindful of time. So the Walrus is a point of care tool. That part does need to be installed, and I don't have a link on, unfortunately, here on the test, but basically there's another sort of links here. This Walrus by Acom Health, or Walrus links. At this stage, it only works with medical director and best practice. And it's installed on the machine where the user uses the clinical information system. So I'm going to open my test system. Okay, and we're going to use BP. And basically, once you download the little tool, it will look like this. You double click on it. Okay. It will launch the application, and then it will sit on the taskbar here. Okay. It'll always sit there waiting. You log in. I'm already logged in, but you log in again with the same credentials that you use for your Polo Explorer portal and the same credentials that you use for your knowledge base. Basically, the same credentials work for anything that you may need to log on using our system. Okay, so I'm already logged in, but there's no patient selected. So I'm going to go ahead into best practice, and I'm going to open the patient. I'm going to move this to the middle so you can see it better. And I'm going to select test patient that I've created. And then you can see that all these boxes populated. Obviously, green is good. Red, there's some urgent items for you to take care of. And then there's orange, which is suggestions are not so urgent. So I was actually a bit shocked because I've been using this profile for quite some time, and I have a new item now because that was my birthday not long ago, and now I've got an eligible for 45 to 49 health assessment. So that was a bit of a reality check. So the piggy bank is potential eligible MBS items. Okay. Then you've got the ambulance, which is risk. Blood pressure recording required, BMI recording required, and whatnot. So anything that may be at risk, you have the opportunity to do a recording while you've got your patient in front of you. Then we've got PIP-QI quality improvements. Okay, this is cool. This is PIP-QI quality opportunity. So let's see, BMI not recorded. So you will click on that, and that will take you to the observations section in best practice or medical director, where you can do a BMI recording. Cool. Once you do the BMI recording or any of these recordings, it won't update here straight away. Again, like I mentioned earlier, it takes 24 hours for any data changes to reflect in your reporting. So it won't disappear straight away. It will take 24 hours to show up. Cool. Then we have the missing information. And in this instance, we've got allergy. Again, we can click on that, and that will bring the allergy window where you can add your allergy there. And then tomorrow, this will be not there. Timeline, that's the commission, so don't worry about that. We've got general patient info. I should really record some stuff here so we can show better. And then we've got the graphs, which we know that at the moment is a known bug, and it doesn't show the information, which we're working on to fix. But essentially, if you've got more than one recording for any of these items, you are going to see the graph as to how that is changing over time. Cool. So if I change to another patient, let's close that. Let's close these patients. We'll open another one. And you can see it's fit in the walrus. And then you've got David Allen, who's a 65-year-old male, and he's got different items that are missing from his profile. So you go ahead and do those items. So this is, like I said, it sits with the practitioner or sometimes with the nurses as well, and they can actively update missing information. And from time to time, the PHN or the Department of Health may be running some programs that may require you to ask the patient some questions and whether they want to partake, and there will be here, you have like some sort of questions that you get to fill out or ask the patients while they're in front of you. That happens from time to time. Okay. We'll worry about that. The walrus is designed to sit at the bottom here, be a little bit less intrusive. You can move it around if you want, and they will just sit there and automatically logs you out after 8 hours if there's no log out button per se, and as this most likely sit with the same person for the whole day, So it will just sit there. Cool. We've got a little bit of time. So what I might show is the patient flagging. Let's see if it'll work here. Yeah. So like I mentioned earlier, we've got patient flagging as well, which basically allows you to identify patients that you might want to keep an eye out at your practice for various reasons. This is a way of identifying patients that you're not able to identify from your clinical information system because the system simply does not record it. And one of the things that it was used for, it was for children's in care homes. One of those specific examples that we use with the practice, they wanted to identify children in foster homes and how to identify them, and you couldn't do that from the clinical information system. The way we do it is we go to flag setup and we create the flag. It's already created here, so you can see foster care, and you go either yes, and that's essentially all you need to know. So you want the kids in foster care, yes, and then we save it. Okay, and then the way it's used from two sections. You can either go patient flag, and if you already know who those patients are, you select the flag. Let's active. Okay. So if you know who those patients are, you select the flag, and you go, okay, this foster care, foster care, foster here, you go yes, and you go apply, and those patients will be flagged as being in foster care. Now, again, that will take 24 hours for the data to show up on your reports. But once it does, you go to reports, you go to clinic summary. Takes a little bit to load. It shouldn't take this long to load. Cool. So from the filters here, if you remember earlier, we got patient categories. I want flag name. This is all the other flags as well. We got foster care. And status, I want yes. And now I'm seeing all the patients that are in foster care, and I can either get a patient list, or you can look at the risk or how they're traveling, or anything, MBS items, anything they may be eligible for, and whatnot on those patients. Oh, that's a pretty cool function as well. It does get used as well for some government-run incentives where they want to trace or track particular patients that meet a particular cohort, and this is how you would do it. So the PHN may run some programs as well, and the way you can see it, if you go to patient flagging, we don't see it in here, but if they've got a prefix which it's PHN, that means that a PHN created flag for you to use, and they will give you further instructions as to what they would like you to flag. Cool. So that is it for patient flagging and clinic summary report and walrus. So I know it's a lot to take on, but once you get access to your data and you start seeing the data and you start digging into some of the reports that we've got, it'll be pretty cool.
Sorry, Diego. There's a question that I think a few people might be interested in. Someone's asking about if the MBS eligibility is real time using the Medicare data, or if we're just looking at the best practice systems.
we're looking at the best practice system from here. Once we look into Husking, we're looking at a bit of both. We look at the clinical information system and the Medicaid data. But that we need to come back for the next webinar at the end of the month on Husky. But yeah, this is just looking at your clinical information system data. This works on the pipeline to look at the product. But at this stage, yes, it is just from the clinical information system. Thanks, Ben. If anyone has a question that may come up after the webinar, feel free to send it to Alex and his team, and they can send it to us, and then we're more than happy to answer questions. Sorry, what I'm going to do now is I'm going to go back to my slides. So we've got a few other upcoming webinars. Obviously, the one that we just did, it's running again on the October 15th. So if you think anyone from your practice may benefit from this webinar, we are recording this, so you can change the share the recording as well. Feel free to share that. Otherwise, they can join and ask questions if they want to. Then we've got guided analytics reports, which we've got a bunch. We've got the PIPQI report, which will assist you with PIPQI activities. We've got the Puffin report that's coming out next week, so I should probably include that in here as well. We do have a Puffin launch tomorrow at 12 o'clock, which is the GPACE report. We've got QIPC report. What else do we have? Hepatitis report. They're much smaller, much easier to use. They're what we call guided analytics reports, because basically they have one purpose and one purpose only. So you go in, you get the information that you need, and you get out. There's no digging, there's no filtering, there's minor filtering, but not as much as the clinical summary report. But they're more self-explanatory. So that'll be a much easier to take on session. Like I said, we've got a Puffin webinar tomorrow, which is on the GPACE patients, aged care, patients in the aged care homes. It basically assists you in identifying what they're missing in terms of care plans and home visits, which is very, very cool. Pretty sure a lot of people waiting for this report to come out. And then we've got Husky, which is the appointment optimization tool, also on the 30th and the 22nd of October. Alex and his team will be sharing all those links. Some have been shared already. These two will be shared later today or at when Alex manages to share them. Yeah, all the webinars start at 12 o'clock, unless started otherwise, which is think that's the best time to spend your lunch is listening to our voice. Cool. So if there's any questions, we're always happy to answer questions. How to register Puffin webinar. Alex, are you happy to share those links? Otherwise, I can put it up on the...
You can put those links into the chat, Diego. That's fine. I would just say to anyone, they are on our website. If not on our website, they definitely will be in there shortly. Yep. We also publicize them in our newsletter, Sydney Health Weekly, but they should all be live at the moment. So if you've got any inquiries at all about webinars or about installation of either Pola or Puffin or Husky, please contact us at digitalhealthassessment.com.au. The URL, the email address is there.
Just share that. Yep. Thank you, Alex. I just shared the link to Puffin. This will be a much quicker webinar. That it won't go for an hour. It will go for half an hour tops. It's a very, very simple report. It's about 2 pages, and it's basically its official launch. So you'll be able to see that as well as everyone else that uses Polar. I think it's back to you now, Alex, if there's no more questions.
I think you answered all of those questions about the upcoming webinar. So I would like to stress there is the more advanced webinar is next Tuesday, the 23rd. And we've got the repeats on 15th and 30th of October, respectively. So if you do have colleagues who would wish to attend, please advise them to do so. Otherwise, I would like to thank everyone for attending. Thank Diego for the presentation and Ben for the support. I would also like to say that while I pasted the link to the evaluation survey into the chat, we will also email you a link after this webinar. So please complete it so we can issue the certificate of attendance, and we also value your feedback. So thank you again. And as I said before, for any inquiries about any product from the suite of Outcome Health, be it Pola or Husky or Puffin, please contact us at Central and Eastern Sydney PHN. Best contact is email address digitalhealth@cespen.com.au. Thank you.
Thank you so much, everyone. Have a good day.